Hey, it's Erin, your ER educator, and we are going to review lab tubes. So for this particular competency, we're just going to look at the different lab color tubes and what labs might be associated with them. In any case, you always want to just follow the recommendation of your policy and procedures and whatever your lab specifies which labs should go in which tubes, and a lot of that can be found on the stickers when we print them to collect orders. So just make sure you're following that. This is just a general overview, and I'm very aware that different labs have different color tubes and that different things can be run in different tubes. So again, follow your policy. But let's get started. So just an easy way to remember order of draw, and again, follow your lab's policy, but this is just one way that I learned when I was in nursing school, but cultures, blood cultures always go first. First and foremost, you always get your blood cultures. Then red, and red rhymes with med, and we'll get into that. But red is next, and red is next because it doesn't necessarily have to be a full tube. Then next is gold, and I always just remember this because your next order of draw is blue sky over green grass and Vikings are last. But I remember that gold comes before the blue sky because the gold shiny sun sits high up in the sky. So gold tube comes first, then blue sky over green grass and Vikings are last. Sorry, Minnesota football fans. And then pink comes after purple if it's needed, and we'll talk about which labs go in each of these things. But for the most part, labs that you'll probably be drawing would be blue, green, and purple. So blue sky over green grass and Vikings are last. And the reason that we draw them in order is because there are different additives to the different tubes, and you don't want to cross-contaminate the additives. Like you don't want an anticoagulation additive when you're trying to get coag studies. You don't want to get some of the other citrate additives in there because it can alter your electrolytes. So you want to make sure that you're drawing them in order. There's a reason for it. All right, so first up is blood cultures. You always want to draw blood cultures first. You always want to make sure that you're getting whatever potential dirty sample that you can achieve into the bottles first before you draw anything else. So blood cultures are always first. You've got a blue top and a purple top. The blue top is aerobic and purple top is anaerobic. When you draw your blood cultures, you want to remove the dust caps, which are the gray and the purple tops, and then you want to scrub the top of the bottle, and then I always just leave the alcohol wipe on top of the bottle until I'm ready to use it. The goal is to get 5 to 10 mLs of blood in each bottle, and then you just want to invert it a few times just to mix up the additive. If you have a limited amount of blood, always fill the blue top first. That's the most important. Same with pediatrics. If you have a small amount, always fill the blue top first. The other thing to keep in mind with pediatrics is if you absolutely need blood cultures, make sure to call the lab and see what the bare minimum is, because it is important, especially if the kid has a fever or we're concerned about sepsis at all. It's important that we get these blood cultures before we start antibiotics. So if you're at all concerned and you're like, gosh, how much do I put in these bottles and we have such a small amount because it's a pediatric patient, call lab, but most likely they're going to tell you to fill the blue top first. Next up is the red top tube. We typically draw these second. This, again, red rhymes with med, so I always just remember that red top is for like medication levels. So like if your patient is on seizure medication and you need to get like a Keppra level, we typically are going to run a red top. Other times, like maybe we have a patient that overdoses and we want to get certain medication levels, we'll draw a red top. So just remember red rhymes with med. Next up, gold or a yellow top. And I always just remember gold looks like serum. So when I think about serum, I think about immunology. So typically gold is going to be for various hormone levels or immunology levels. So things like your thyroid or IgG or IgE. Again, there's multiple other things that could be run off of gold, but these are the more common ones. And just remember, if you're thinking about order again, the gold sun is high up in the sky. So this one goes before the blue top. So next up is your blue top, which is your coag studies. So one thing that's super important with the blue top is it needs to be a completely full bottle. So this is one of the reasons that we don't typically like to draw this one first, because if you're drawing off a line, it's going to pull the air from the line into the tube and you won't fill the bottle. So you can get away with that by using a syringe, or you can just use the transfer device. But just be mindful of that. Sometimes you have to do a waste tube if you forget or whatever, but the blue top needs to be full. I always remember blue top is your coag, because if you think about your blue veins, you need blood to clot, which is your coag studies. So that's just kind of how I remember it. Blue is your coag. So things like INR, PTT, PT, a D dimer would be blue. So that's just how I remember that one. And when I put the normal lab values on here, again, follow your lab's recommendations and their lab values, because they could be off just a little bit. So just follow whatever your policies and procedures are. Next up is green, and I always think of green like green leafy vegetables. And when I think about green leafy vegetables, I think about healthy things and all the things that those vegetables provide to us, which are our nutrients and electrolytes. So I always think of like green would be like your basic metabolic panel, your complete metabolic panel, and there's a bunch of other ones which I'll talk about in just a minute. But this one always goes after the coags because it has heparin in the bottle, and if you draw this one before the blue, it's going to throw off your coags in your blue. So this one has to go after your blue. And again, so here are some common labs that are drawn off of it. Other things that we get off of a green top tube, lactate, ammonia, both of those have to go on ice if you draw them. Troponin, magnesium, and to this day I have no idea why mag is not in a metabolic panel, but whatever. Cholesterol studies, your liver panel, some thyroid stuff, CRP, and now BNP is getting run off of a green top, which is kind of a newer thing. But yeah, these are just some other examples of the green. Just make sure it's after that blue tube. All right, after the green tube comes purple, and purple is like your CBC. So your red blood cells, your white blood cells, your hemoglobin, your platelets. Again, you want to draw this after your metabolic panel due to the additives that are in the tube. And how I remember purple and your CBC, purple comes from mixing red, or your arteries, and blue, which are your veins. So if you think about blood mixing between red and blue and getting purple, the rest is your CBC count. So it's like your red blood cells, white blood cells, platelets, etc. So red and blue make purple. That's how I remember this one. Lastly is pink, which is your blood type and screen. So if a patient needs to get a blood transfusion, or if they're bleeding and they potentially need surgery, we would want to get a type and screen, which is a pink top. Sometimes, depending on if the patient has had a type and screen before, they may have already had their blood documented, and then you would just need one vial. If they're a new patient, they've never had blood drawn before, and sometimes you need 2 vials. If you absolutely cannot get a pink top, sometimes it can be run off a purple tube, but that's going to delay getting your lab results back. And this one in and of itself takes about an hour to get back anyways. So you want to try and get this one down to the lab as quick as you can. When I always think of pink, to remember this one for your blood type and screen, I always think, it looks like baby pink and you figure out your blood type at birth. So that's how I kind of remember that one. So as a review for your order of draw, cultures always come first. We always want to do our blue top before our purple top. And if you have a limited amount of blood, always do your blue top. Next is red. Red rhymes with med. So remember, those are your medication levels. Then next, gold is like a shiny sun high up in the blue sky. So gold goes before blue. And remember, gold kind of looks like serum. So it's your immunology studies. Blue sky. So think about blue as in your blue veins. Those are all your coag studies. So things that you need to help you clot. Blue sky is above green grass, and green, think about all of the healthy electrolytes and nutrients. So your basic metabolic panel, your complex metabolic panel. Then you've got things like troponin and ammonia and lactate. Okay, so just be mindful of those too. Some of those need to go on ice. And then last is your Vikings, because Vikings are last. So gold is high up in the sky over your blue sky. Blue sky goes over your green grass, and Vikings are last. And remember, purple, red, and blue mix, your arteries and veins mix, and that gives you your CBC. And then pink is last if you absolutely need it. And remember, you find out your blood type when you're a baby, so pink is your type and screen.